Hello, this is Dr. Gabe from First Look MRI, and these are two super nice guys who came in back to back, and they both had tears of their biceps. And the one on the left here had a tear proximally here up in the shoulder, and we see that the biceps muscle belly is low in position. The biceps attaches up here to the glenoid in the shoulder, and his tendon tore and dropped the muscle belly down. It looks like a Popeye arm, we call that. And this other patient had a tear not proximally but distally. The distal biceps attaches down here in the radius, distal to the elbow joint, and his muscle belly is superiorly migrated because the tendon is torn and it allows the muscle to contract and drift upwards. So if we look at their images, we can see the gentleman on the left who had his tear up high. So this is the glenoid, the cup of the shoulder. This is the humeral head. And the biceps tendon comes right off here at the very top anterior corner. We call this the biceps labral anchor, and it is torn from the labral anchor, and the biceps tendon courses over the top of the humeral head and comes down through the bicipital groove. And his is torn from here, retracted all the way down, and we can see the end right down here. This is the musculotendinous junction. The tendon itself is difficult to find, but this is part of it right here. And on this view, this is called an axial image where we're slicing in short axis. And we can see a little area of brightness. This is the biceps, the bicipital groove where the biceps tendon is absent. We see a little fluid collection where we should see a dark biceps tendon. So again, it attaches up here. It goes through the bicipital groove, and his is retracted below, well below the bicipital groove, again down here. Now the next patient had a tear distally. This is what theirs looks like. This is a sagittal view. This is the front of the elbow. Here's the back bony prominence of the elbow. This is a different muscle here that's okay, the brachialis. And the biceps should attach on this bony protuberance. This is the radial head, neck. This is the radial tuberosity, and this bump here is where the biceps attaches. And the biceps tore from there and is drifted way up here. The torn end is up in this region. We see the torn end on this view a little bit better. The muscle is here. We see the muscle belly is migrated upwards. And we see this dark band as the biceps tendon that's retracted and recoiled upon itself here. And all this white stuff here is fluid or hemorrhage all throughout, but it should attach way down here and it is drifted up. So again, our two guys got to meet each other with tears of the proximal and distal biceps tendon.